Good morning, Professor Hoffmann.
Good morning, Alex. I'm happy to be with you. So I will talk about issues of radiation protection that are not focused on Fukushima, but of course they have a close relation to what we discussed today with the experts. And so let me share my slides with you. Yeah. So I will talk about low-level radiation and health risks in a more general sense, but you will see historic aspects that are closely related to what we discuss in this special symposium of today. And my field is epidemiology, which is easy to see. This was 1986, and this was Chernobyl, and you see the remnants of the bursted reactor there. And these are the pictures from that time. And we had a discussion after that because a major group of experts, more than 100 experts, went to Belarus and did a lot of research, and they came up with the conclusion that there was no health disorders that could be attributed directly to radiation. However, there was substantial negative psychological consequences and stress-related illnesses. The numbers were looking quite differently. You can see that from the table in the lower part of the slide. There was a steep increase in thyroid cancer in children, coming up to a manifold risk ratio that was observed, and this was earlier than the report was issued. So already in 1990 there was an almost tenfold increase, which was completely ignored by the experts then. And you can see the discussion in the scientific literature. So there's little doubt that the number of children reported to have thyroid cancer increased so dramatically, and in Belarus in 1990 was one of the two fields of argumentation. The other one was that we do not know how many of the recorded cases were dedicated as a result of medical screening, and how many cases clinically manifested themselves in 1992. Of course, there was an urgent need for research to establish beyond doubt the reported increases, which was then done without any doubt. And concerted support from the international community is needed. And some of this may sound familiar to you. These were the numbers. This was one of the highest increases of a cancer that has ever been observed in the world. And of course, it appears highly likely that radioiodine served as a cancer initiating event, and there's no doubt today. Fortunately, the numbers went down among the children, but this is only an artifact, because at the same time the numbers went up for the young people and even more for the adults. This is the only reason is that 15 years after Chernobyl there were no longer children exposed in their lifetime, and so the increases turned to the older ages. From the back, we can see now that there was about 16,000 incident thyroid cancers after Chernobyl, and 25,000 incident other cancers, and this is minimum numbers that could be documented, and there will be many more that could not be documented. At least 15,000 excess cancer deaths. So don't be too quick with the conclusions that there is nothing. And the same is true for Fukushima. Fukushima looked like this in 2011, and briefly after that the first reactor exploded, and only 2 days later the second reactor exploded, and this is how it looked, and it seems quite similar to my view. This is the distribution of the radioactivity coming out of the Fukushima accident, and we were so lucky that the wind was blowing towards the sea and not towards northern Japan. Before that, in 2008, there was a major endeavor of the nuclear industry to have a comeback, and they had new technologies and they were completely safe and so on, and so our chancellor tended to turn towards nuclear power again, but after Fukushima, the same major journal here in Germany titled, "This is the end of the nuclear age." Unfortunately, next year we will switch off the last nuclear power plant in Germany. But we are talking about health risks. And this is the first Fukushima cancer. We will hear more about Fukushima cancers today. This is not my topic, but it's what happens when radioactivity is distributed to the population. I will tell you the story in Germany. This is 1992, and back then, there in the newspaper here, they titled "Leukemia statistically completely normal." At this time, the leukemia cases looked like this. The circle has a radius of 5 kilometers, and you can see here a major cluster, as we call that, of childhood leukemia cases. These are the exact numbers, and you can see a 5-fold increase, which was true both in the period 1990 to 1998 and 1999 to 2005. So this is an ongoing cluster, one of the largest clusters in the world. And this gave rise to a major research endeavor throughout Germany, which was dedicated to clarifying the question whether or not we have a childhood leukemia risk in the vicinity of nuclear installations with no accidents. So this is only usual operation. You can see here the nuclear power plants distribution in Western Germany. And these are all the cases and all the controls sorted by the direction and the distance of the nearest nuclear power plant in Germany. And the experts have an idea that there's a little more red dots in the center, towards the center, and this is exactly what came out in this study. The childhood cancer cases were a little closer to the nuclear power plants than the controlled children were. And what came out, then they had a model that is a continuous model with distance from nuclear power plants, and the coefficient was always above 1, and also significantly so for all leukemias and acute lymphatic or lymphoid leukemias. So there was a clear distance trend with a steep increase towards very small distances of, let's say, 1 to 3 kilometers of the plants. So, and many sensitivity analyses and also risk factor evaluation all came up with the same effect. There was no other explanation than the distance from the next nuclear power plant in normal operation, which means that there is a risk through these nuclear power plants. However, in the conclusion in the report, the authors stated that based on current radiologic and epidemiologic knowledge, the ionizing radiation emitted from German nuclear power plants in normal operation cannot be interpreted as the cause on fundamental grounds. So there's no argument in any scientific way anymore. This is now fundamental grounds. It must not be. But the same was found in other countries, Switzerland, Great Britain, and France, which is not on this table. They all have a risk of childhood leukemia in the vicinity of nuclear power plants. So this is what we call consistent. These are consistent risks, consistent findings, which add to the causality of these results. There's other things that we didn't like to see, and we did find it anyway, which is the natural radiation exposure. Natural radiation exposure is not the level of harmless dose. It is still connected to health risks, and we know that from indoor radon. So this is only natural radon that is accumulating in homes, and these are all the studies that have been pooled and meta-analyzed and put together in a firm methodologic approach, and we see an excess relative risk of 11% per 100 becquerel per cubic meter indoor air. And you see increased risk in subgroups with better exposure assessment, which is important because whenever the exposure assessment gets better, the risks get more real. And if risks are higher with better exposure assessment, that means that the risks are higher in the real world. This accounts for some 15,000 to 23,000 of all lung cancer cases in the US. So natural radon is the major risk factor for lung cancer in non-smokers. Similar results have been obtained for exposure to background radiation. So this is the gamma rays from the ground, mostly generated by natural uranium ore. The Swiss did a major study connecting residents of children with cancer to the natural background radiation, comparing that to control kids, and what came out was a very clear dose-response relation for all cancers, for leukemia, and even a little bit for lymphoma, but more so for CNS tumors, that is already significant for very, very low exposures of some 2 millisieverts per year. So this is natural radiation that causes significant health hazards. But there's not only natural sources. This is the doctors. This is us. Medical X-rays have been celebrated as a major breakthrough in medical technology, and of course they are. But we did not look for the risks. This is one of the first publications, studies that addressed the risk through medical X-rays. This is the numbers of abdomen X-rays for pregnant women, and the line give the risk for cancer of their later born children. So children exposed in utero have about doubled risk for leukemia until the age of 15 after 4 to 5 X-rays of the mothers. So back then there was no entry with 0, so every pregnant woman received X-rays, and this was clinical routine to assess multiple pregnancies, and also the pelvimetric assessment, so whether or not the head of the child would fit through the pelvis of the mother. And so this has been abandoned due to these studies, and of course this was not believed as well from Alice Stewart, the first ones. So many scientists had to reproduce that in different cohorts. This is only a meta-analysis of all these cohorts that all showed the same result, that is that children exposed in utero have a higher cancer risk later on in their life. And so the discussion went on for many years. This is a model from 2007, and these authors have calculated that only through CT scan practice in the US, every year 29,000 cancer cases would result. This is only through medical CT scans in the US. And you can also say which kind of cancers that is. So 14,000 for abdomen and pelvis, 4,000 for the head region, and 2,700 for the chest. Back then this was based on risk factors that have been derived from other studies, but calculated here for medical X-ray doses. This has caused a major discussion about the safety of CT scans. So CT scan is a high-dose procedure, or at least was back then. And in this discussion in the New England Journal of Medicine, the author said that the risk would be in the range of %. So 1 of 80 people receiving a CT scan for diagnostic purposes would contract a deadly cancer from that within the 3 decades after the procedure. Later in 2012 we had direct effects that could be measured in cohorts exposed to CT scans in childhood. And there's a very clear dose-response relation again. And these are not high doses. This goes up to 50 milligrays, and the relative risk is already 3 for kids who received CT examinations in their early childhood. And this is leukemia in the first graph and brain tumors in the second graph. The same was done for younger adults, and younger adults had the same, basically the same effects. This was an analysis of the women who have mutations that increase their breast cancer risk. And of course, these are important to monitor for breast cancer so that it can be detected quite early. These women were sent to mammography. So again, causing radiation exposure to the tissue of the breast. These are high risks, significant risks in very, very low doses through mammography. And this means that we have to reconsider mammography for these risk groups. And these authors in the BMJ, they suggest that we should no longer use ionizing radiation imaging techniques, but rather magnetic resonance imaging. It took another 15 years until we now are doing that more consequently than before. These are the young adults, as I mentioned, and they also show a clear dose-response relation between medical CT scans and cancer risks. There's other things that we never believed, but they're still true, and research brings out these issues. This is the chronic lymphatic leukemia story. In many textbooks from older ages, you can see that any leukemia can be caused by ionizing radiation, except the chronic lymphocytic leukemia, which is quite handy because this is the most frequent type of leukemia and had never been compensated for example, occupational exposure. So they just excluded chronic lymphatic leukemia from the group of leukemias that can be caused by, for example, occupational radiation exposure. In this paper and others, it was shown that this is not true. It is a methodological artifact. And some other authors then reconsidered their own data, and they said in the second consideration that their findings now confirm, support the hypothesis that CLL is also radiogenic. But this was only after the discussion had been initiated. And then what rarely happens, and this is a clinical journal, it's not a radiation protection journal, they considered they could have been wrong with their previous assumptions. And the Americans included lymphocytic leukemia in the list of occupational cancers caused or potentially caused by ionizing radiation. This was important because in the under the Energy Employees Occupational Illness Compensation Program Act, almost all survivors of the Manhattan Project who had been exposed to ionizing radiation were these chronic lymphocytic leukemia patients, and so they could be compensated other than before. Other colleagues reconsidered their previous assumptions as well. For example, the radiation workers' risks by radiation. This group here has ever held the position that there was not a high risk, and basically most of the cancer cases in the occupational field come from other causes. But then they published this paper where they contrasted the risk estimates by the International Commission on Radiation Protection with the IPI risk. So that means with the real risks that has been assessed, has been calculated and measured in epidemiologic studies. And this is about a factor of 2 higher. And of course, this is completely true because the error that is involved here is the underestimation of radiation risk by the International Commission for Radiation Protection, for example, because they assumed that there would be a reduced risk for low doses and also for low dose rates, which is simply not there. And this is from 2021. We now finally accept that there's many other diseases except for cancer and genetic effects from ionizing radiation as well. And this is here. There's the non-cancer effects on the circulatory diseases, on cognitive functions, on lens opacities. I would like to add some more points here. There will be a lot of discussion in the next years. This is a major program of the European community that is investigating that. So these dose response curves with radiation dose, they do no longer address cancer. They address heart disease, they address hypertensive organ damage, they address stroke and other things. And the overall risks are even a little higher than they are for cancer. So this means there's a whole lot of new radiation effects that have not been considered before. Radiation is almost double as dangerous for human health as it used to be before. And there's new things that need to be discussed, including cognitive effects, effects of radiation on the development of the childhood, of the child's brain. There's good epidemiologic evidence now there that low to moderate radiation exposure has an impact, and a negative impact prenatally and also in early childhood on the brain development, on the development of intelligence and other brain functions. Cataract has never been an issue in radiation protection. It now is, because there again the assumption of a threshold has not withstood empirical evidence from epidemiologic studies. So we now know that even in the range of CT scans of the head, we have an increased risk of cataracts. That of course then needs to be figured in the risk and utilization and risk and benefit evaluation of the clinicians. There is, unlike previous assumptions, a risk for fetal birth defects by low-level radiation. This is a publication of the registry for birth defects from Mainz, a very high-quality registry, and they say a higher prevalence of infants with birth defects was documented for mothers who were occupationally exposed. Within the limits that are permissible in Germany, they already have as the consequence of higher risk of birth defects for the children of these mothers. We have benign thyroid diseases that are closely connected to radiation dose. These are two graphs from Hiroshima survivors, and you can see on the left side this is thyroid cancers, and the same axis and the same way of depicting the association is on the right side. Benign nodules of the thyroid have the same dose response, but they are of course much more frequent, which you can see from the smaller confidence limits here. Also, autoimmune thyroid disease is connected to radiation, as we found in Eastern Germany. So this is a good time to get real. We need to be less biased. We need to be open for new empirical evidence and no longer argue ideologically in front of nuclear power use. So we will not have atomic energy labs for our kids, including a radioactive source in this package here. We won't look through a X-ray machine to figure out whether our shoes are fitting our feet. And we will not go in a van like this here, which says, walk-ups welcome to get a spiral CT and come out with 50 millisieverts effective dose. So, this is why I'm working and living, and I'm happy if you discuss with me. So I try to be a little provocative, and we do have to be provocative because the issues are just too important to be discussed only by people who are ideologically biased. Thank you very much.